So now you tell me what's my name. Susie McDonald. Okay. Yeah. Okay, let's get started then.
Hello, I'm Dr. Poonam, one of the doctors in the clinic today. May I confirm your name and age, please?
Hi, doctor. I'm Susie McDonald and I'm 51.
How may I address you?
Susie is fine, doctor.
Yeah, Susie, I'm sorry that we are not able to find your case notes, but we are doing measures to find them. And right now I'm having your discharge summary with me. And I do understand that you have undergone some surgery for stress incontinence. Is that right?
Yes, doctor. I'm so happy. Yes, I had a surgery and now I'm so relieved. I don't have any symptoms. Thank you, guys. You guys have done a good job. Thank you.
Yeah, good to know, Susie. And otherwise, your recovery is fine.
Yes.
Yeah,
Everything is good.
yeah, good to know. And any problem with the bowel opening?
No, doctor. No problems.
Okay. And may I know the symptoms what you had before this surgery?
Doctor, I had some leakage of urine on coughing, sneezing, lifting weight, and all that. So, yeah, I don't have any more problems now.
Good to know, Susie. And some question I may ask before moving forward. And at the end, we will reach to a mutually safe and agreeable plan. Is it okay for you?
Okay, doctor. Yeah. Is
And
it okay?
yeah. And Susie, have you been pregnant before?
Yes, doctor. I have 3 children.
Okay. And may I know the mode of deliveries?
Normal deliveries, doctor.
Okay. And from my notes, I am also having that you are having diabetes also. Is that right?
Yes, doctor. I have diabetes.
And
controlled.
Is it controlled? Yeah, good to know, Susie. And any other medical concern?
No, doctor.
And any history of surgery apart from this tape surgery?
No, doctor.
And do you, what about your periods, Susie?
So, doctor, my notes don't say that I have diabetes, okay? So I don't have diabetes. And I said that whatever's written in that Lisa told, I'm not following that. And I think you remembered from there, okay? Sorry, now you can continue back. Okay, so what were you saying?
Yeah, I'm saying that have you got your changes of menopause, Susie?
Yes, doctor, yes.
Yeah, and any hormonal replacement therapy has been offered to you after that?
Doctor, my GP will be discussing soon with me. So, yeah, I have an appointment due soon.
Yeah, okay, Susie. And some intrusive questions, Susie. Are you sexually active?
Yes, doctor.
And any
not since operation. We haven't yet done since operation, but yeah, I have a partner.
Yeah, okay, Susie. And are you aware of your BMI, Susie?
It's normal, doctor.
Okay. And Susie, thank you for giving this information with me. And I have your examination finding with me. Susie, do you want someone with you, as I need to give you a lot of information? Do you want someone with you?
No, doctor. Is everything okay?
Okay, Susie, there is some concerning news, Susie. This examination is showing that the mesh used in your operation, it is not covered by skin, means it is exposed.
So what does it mean, doctor? Why
Uh,
do I need to worry about it?
yeah, Susie, there are few concerns with this exposed mesh. There are chances of infection, and if this is exposed, there are chances that it may damage to the surrounding
What do you mean by
structure.
exposed? I don't understand. Where is it exposed? What's happening?
It means that skin which should be covering this mesh,
Mhm.
it is not covering the mesh. Mesh is exposed, means it is not covered by skin.
Okay.
It has not
Is that
healed
bad?
properly. Yeah,
Is it
it is
something
not.
bad?
Yeah, if it is exposed, there are chances of infection, Susie,
Okay.
because the skin is a barrier for infection and it is not covered by skin, vaginal skin, Susie.
Okay. So what do we do?
That the area is 5 millimeter. What we usually do is we provide you with the estrogen cream. You need to apply on this area, and you need to apply it for 3 months. And I will also inform my consultant regarding the same. But few general measures like the sexual intercourse, if it is avoided, it will be better, because the sexual intercourse will further increase the infection
So I
till the
cannot have
healing
sex
process.
now?
Pardon, Susie?
You mean forever or for some time?
It is for some time till the healing has happened, Susie. And
Okay.
your estrogen cream need to be applied for 3 months. And most of the women in this healing happens in 3 months, and your further follow-up will be after 3 months. And we will check again this area. And in the meanwhile, if you have any discharge or any bleeding down below, you need to come back to us, or any problem with the waterworks, and clinical contact details will be shared with you.
Okay.
And most of the women it heals. But if does not heal, Susie, I'm concerned that we need to remove it.
You need to remove what?
This mesh.
But it's controlled my incontinence. What would I do?
I clearly understand, Susie. Your concerns are well valid. But if it is exposed, then it will do more harm than benefit.
I
And
was told that it's not easy to remove.
yeah, that is also true, Susie. There are few facts I need to explain to you. Then healing, most of the women heal in 3 months, but if does not heal, that removing in that area which is exposed may help in healing of that area. And this is at times that we are not able to.
I don't understand. You are talking about removing, where will my symptoms go? What will happen? I really don't understand what's happening here.
Susie, I try to explain you. Your symptoms are relieved. That is very valid. But if exposure will continue, that it might erode into the this water bag, and that will cause more harm to you in future rather than benefit. I do understand that it is benefiting you right now, but
That's very bad. I don't understand what do I do? This is not good.
yeah, Susie. Meanwhile, I'm giving you this estrogen cream. You need to apply. Most of the women may recover after 3 months, and that if it is does not happen, then we need to remove it,
I'm
Susie.
very,
And
this is very disturbing, doctor. I don't understand what to do. This is like, oh my God, I was so happy when I was coming to the clinic that everything is sorted, and oh God, this is so disturbing.
Susie, I do understand your concerns. That is very valid. Um,
Oof, this is so stressful, doctor.
but be assured, most of the women may heal after 3 months, Susie. Don't get disappointed.
But some women don't, yeah?
Yeah, that's true.
What do you want? What you want to just give me this medication? Yeah, cream.
Yeah, I'm giving you this cream. And we need to report this case as in
So you've
our
crossed 10
registration.
minutes now. I'm not worried about time as long as you know what you're saying. But if you cross 10 minutes past, spent that 10 minutes and you said incident reporting after 10 minutes, then you actually, ruined quite a bit of your station. Okay, let's stop here. Was there anything else you wanted to say, Mona, in the meantime?
No, ma'am. Thank you.
Okay. So good thing is that you tried. Very good. Excellent. Okay. I know it's still, it becomes a bit unnerving. Okay. I can tell you one thing. In exam, there is no one else watching. So you're much more comfortable. This should be reassuring thing. Okay. No one else is watching, and that's very reassuring. So you perform better in exam. Okay. That you should note down. You should feel reassured about that. Now, what has happened here? Somebody can point out a couple of mistakes here.
Yeah,
The diabetes to be controlled, ma'am. Whether it is controlled, that has to be
So
verified.
I said that this patient will have characteristics that I define, and there was no mention of diabetes in the question. That was a mistake. So this is, I did this intentionally. There was no mention of diabetes in the information that I gave you. Okay.
Okay.
In the candidate instructions. So
can I say something, Dr.
Poonam
Sir?
said diabetes, and I said it's controlled, and then I realized that where she picked this diabetes from, she just remembers the station from the book. So please see that this happens in the exam as well. You're thinking of a recall, and they may have changed it. Okay.
Oh, okay, ma'am.
Yeah. So please, this is very dangerous to know the things beforehand. Knowing is very dangerous because they may have changed. Okay.
Ma'am, urine culture, ma'am.
Absolutely, there are things that were missing. Yes,
And swab from the vagina.
Swabs.
Sent for culture.
Yeah. But main problems that were here, yes, you can keep pointing out as I'm talking. I love for all to brainstorm and to keep saying
you
things.
Told no, ma'am, incident reporting. You should apologize to the patient that what has happened.
Apology. Oh my God, there are two parts of this station. Okay, one part is management, one part is dealing with a complication. Yeah, and there comes apology. Okay, apology and incident reporting and mention of pulse. Okay, mention pulse as well. Okay, so that's very, very important. That if you think you will struggle with time, then you can say those 2-3 words in the beginning and say we'll talk about that in a minute, and you can talk about that in a minute, but then at least the examiner would have noted that you have said those things, and the role player would have noted as well that you have mentioned. Even if you couldn't elaborate, they will kind of put a little tick there that okay. You see, whenever you're struggling with time, just mention a little bit that I will come to how we will handle this aspect of having a complication in terms of reporting this on our system. And if you wanted to make a complaint to PALS at all, we have all the procedures in place. But at the moment, if I can first talk to you about this medical issue that you are having, any implications on you, would you be okay with that? Now, there were very strange things here that you guys are so much hooked to information gathering that you are asking, I have a mesh exposure. Now, how is it going to help you if you know whether I have 3 children or 7 children or 10 children? How does it help? Or if I don't have any child, how it will help you if I came to you with stress incontinence, okay? And you wanted to know, what are the contributing factors? But now I already have a procedure, and you don't have that kind of luxury of time here, because you see, you have 2 aspects here, medical and medical legal. So I would advise you against these things, okay? So please resist your desire, your irresistible desire to get information from the patient. You have to please control that, yeah? So do you think, Poonam, that you could have avoided the question about children? Sweetheart? Yeah? Hello, hello. Are you here, Puna? Or have you gone? Puna is offline?
She has written that her connection is problem.
Ah, right. I didn't see her message. Okay.
Yeah.
No worries. So yeah, the issue is that please be very focused with your questions. Okay. Try not to obtain lots of history. Just tell me first what's the problem. Okay. I always say it first, and then this is not a BBN station, please. This is a complication. I'm sorry. I have to. I don't seem to have a very good news for you. That this is enough. She doesn't need support, or she doesn't need a person there. This is not really a BBN station. If you want to do a little, very many BBN, just say, I'm so sorry. This is, I have a kind of unpleasant news for you. And that's it. That should be enough. Okay. Yeah. I mean, if you wanted a nurse to be there, fine. I wouldn't like deduct your marks maybe for that, but that's such a waste. Okay. But don't need to ask, do you want anybody to be present and all that? That's not required. Okay. This is my, whenever there's a question in your mind, whether this is a BBN or not, ask yourself, is she going to die? Is there an impending risk of death? Okay. Without treatment, then it's a BBN. Either her death or her baby's death. Okay, that would be a BBN. Okay, otherwise there could be many BBNs, like mild ones, and there could be no BBN. Okay, so this is like a mini one. There's a problem. Tell her in a sympathetic, empathetic tone. That should be enough. Okay, so now tell that in advance rather than talking about so many other things first. And how many people noted that there was several times a repetition of what? Tell me what was repeated. Please tell me. What was it that kept coming back? She kept repeating. What was that?
Because you are asking several times that the mesh eroded, she told that I'll remove this one. So you are asking that why you'll remove, and it will be
no. Other than that, was there anything that she kept repeating?
Estrogen cream.
Yeah. So at least 7 times, I think she said. I need to hear the recording again to count, but it was at least more than 4 or 5 times. Okay, 5 times at least she said. Okay, but maybe more. Okay, so this is not a good thing to say. So so many times. And so welcome back, Poonam. You can hear us. So. Yes, Poonam, welcome back. So we said that you repeated estrogen cream so many times. That's not good. Okay. So we were talking about good things as well. I think now you have to go back to the recording when I share it, that what were the other things that we talked about. But yes, talking about estrogen cream was repeated too many times, way too many times. You should have quickly come to the management plan. How would you address this patient? This is a patient who has come for a follow-up for her, TVT procedure. She's very happy and all that. You ask her, how are you doing? Any problems, any symptoms at all? So this is how I think I will start. Information gathering is fine, but it's for the post-op, not for her history of her evolution. Okay. So I'll ask her, how have you been doing? Any symptoms at all? Any problems with the vaginal discharge? Any bleeding down there? Any spotting down there? Have you been sexually active in this time? Any problems with that? I said I haven't been sexually active. Okay, fine. So no spotting, no, and you will then say, okay, I see that you are quite, and yeah, sorry, how is the incontinence now? Totally controlled. She didn't ask me how is the incontinence now, I think. Or maybe she asked, I've forgotten now. So how is the incontinence problem now? Is it totally controlled? Okay. Yes, well, I want to be so happy for you, but I am so sorry. I do have a news of concern here. Sorry. And she was like, what happened? So I'm sorry, it seems my colleague has examined you and there seems to be a little area which is exposed of the mesh. Do you know what it means? She says, no, I don't understand. It means that normally after the procedure, we expect that the skin or the mucosal lining, this lining will cover or the tissue in the vagina will cover the mesh. It seems that it hasn't happened in your case. It hasn't completely happened in your case. So, oh, what does that mean then? So I need to see what would be the risk factors. Why has it not happened in your case? As well as we need to manage this. I also need to report this on our, in a system, internal system, which is called DATEX. We do something called incident reporting to get to the root of it. And then you don't need to talk about pause right at this point. You can leave pause until I say that, oh, this is very distressing. And then you can say that as although I'll be adding this to our system and it will be investigated and all that, you will also say that now you can say that, that I will inform my consultant about it and I'm happy to give you the details of the pause. And I'm so sorry. And you didn't offer me counseling, okay? I know this is very stressful. Do you want me to bring some counseling for you? We've got very good counselors available. Okay. Are you all getting my points? And then you are talking about, there is no place of history here. No place of history. Okay. Like of history of past history. Like there's no place for that. You'll be wasting your time. So what you are saying here is that only history of the symptoms afterwards. And then you are saying that how will we be managed? To say that I'll assess your, so I said I'm not diabetic, okay? So your patient may be diabetic. So just deal with it accordingly and say that there could be risk factors including, conditions like diabetes, which is or is not the case in your case. And then there could be some element of infection. There could be sometimes some element of infection during the procedure. We need to, find out what the cause has been in your case. Sometimes we may not be able to find a cause. It's very important for us. Now, another thing that you didn't mention, you talked about, you talked even about removal, but you didn't say, I'll tell you in a minute, Atya. So I was reading the message and I forgot what I was saying. I will not be reading the messages anymore now. So I think you should shut that window. So, okay. So, see, it evaporated. I think I'm getting. So when you're saying, oh, my internet connection is unstable, it's saying, okay. So you will be offering this MDT will decide about whether it needs to be removed or not. You will not say we will need to remove it. We may need to. You say that if this estrogen cream doesn't work, we will need to refer you to the mesh MDT, and they will then decide what to do. This can become complicated. I'm not an expert to be able to comment whether this any removal will be required or not. Rather than keep telling me that I know this is important, otherwise it will do this. You can say that there are potential complications that can happen, but it will be beyond my expertise to comment whether this will need to be removed or not. But I'll make a referral. There will be a team of experts who will assess the situation and who will decide whether a partial or a total removal is required or not, or if it will work for you. Okay, so please know your limits. You guys start talking as if you are know-it-all kind of person. We are not know-it-all kind of people, okay? So always, whenever this is something like this, why are you saying that, yes, it will need to be removed? Why are you saying, who are you to even, you don't have that expertise. All you are doing is give her estrogen cream, do the swabs as who said, I think, yeah, do the said, do the swabs, yeah, do the test her urine for any element of infection and all that. Yes, you'll do all that, and then you can also check her blood sugars. Why not? Maybe if she's not a diagnosed diabetic, you will do that, okay? And then you will do that. Say that this is what I'll do, and I'll refer you for MDT so that they can assess whether you require that or not. And then you will say that I'll do the incident reporting. There will be an internal investigation on this to find out the root cause for this. You will be given an appointment by the manager for a formal apology once we have discovered the cause and all that, okay? We are very, very apologetic. This is not the standard of care that we expect. And although these complications are known to happen with the mesh, and I hope that this, you were informed about these, but still that, that still does mean that we will still investigate this matter, okay, as a departmental protocol. So this is what you're saying. Yes, as soon, if until the end she hasn't said she's distressed and all that, it will be very good idea to still say that if at any stage you felt stressed about the situation, you didn't feel that we are helping you as per your hopes and anticipations and expectations, there is always option of going to the PALS. And sorry, whoever people tell you that you should never deliberate information about PALS yourself unless you ask them. They are not correct, they are wrong. She will not say that I want to complain. You will still need to give her information of PALS, okay? But be very natural. Don't just push everything, don't just throw everything on the patient in one go. Just see how it's going, and then, at a normal, natural pace where you can, slightly push it in slightly with that this also exists. So they know that you are aware that you have to, it's good to inform the patient of your choices, then fine. You should know that whenever there's an incident reporting, then it's very important to mention that you will be given an appointment, to be seen by the manager for a formal apology once we know once we know what actually went wrong. Okay, so is everything there? So this is a multifaceted station. They're very beautiful and interesting points of this station. If you remembered like 60% of these points, you will pass. Okay, you'll pass with a 2, 2, 2, 2, 2, not with a 1, 1 or 2, 2, and not that. If you remembered even 60% of these, you should have a good pass. Okay, got it?
Yes, I have a question.
Hafsa? Yeah.
So, in the incident reporting.
Sorry?
The incident reporting. Considering the fact that it's just a 5mm exposure, and there could be patient factors that are contributed, like a menopause. So if incident
it is safe to mention incident reporting because this is a complication that has happened. It is absolutely safe. They will require you to mention that. Incident reporting does not mean that you are assigning blame to somebody. It just means that somebody needs to see this, okay? So even if it's 5mm, it's absolutely a good idea to do incident reporting. Have you read it somewhere that if for 5mm should not be done?
No, I've not read it somewhere.
Yeah, just cover, because mostly when they talk about the complications, what I want to tell you is mostly when they talk about the complications, post-op complications, they want to know that you know the medical and the medical legal aspects. So for that, 5mm gives you an opportunity to express both maybe they were expecting and you didn't say it, that will make you lose marks, lose score, okay? You will, get 1, 1, 1, 1 in all then if you didn't mention that. Okay, whenever there are post-op complications mentioned, they definitely want you to talk about incident reporting. Okay, they can make it 1 centimeter in the exam. Okay, I think I've heard of a 1 centimeter in the exam as well. Okay, so but it's always safe whenever you can't think of whether this size is enough for me to say it or not. It's better to say than not to say it. Just if you are not very convinced, you waste less time in that. You just mention and run by it, just quickly go through. We'll talk about this in a minute. That minute may never come, but you have mentioned it at least, okay? Just like there are some stations where the patient ends up saying, pregnant patient says, I just smoke once or twice, or occasionally I smoke. And people don't understand how to deal with that. Like people say, okay, Oh, okay, that's not a problem. I've heard people saying that, okay, that's not a problem. Now, this is very dangerous attitude, because in your mind, you are thinking that this is a big station. I'm not focusing on smoking at this point, but this is the mistake here. You have to have a holistic approach. You can't do dangerous things. So if there was a situation like that, you always say, that is something that will need to be looked into. We will talk about smoking and how we can help you with that, okay? And then you can move on. You don't have to spend all your, you see, you guys think that all of your, you have to finish everything. You have to, just all the bulk of the information that's required there, you have to deal with that there and then. That's not the case. It's your ability to highlight that this is important and I'm not going to let this go, even if it's 1 or 2 cigarettes, okay? Some people say a BMI of 26 is normal. No, it's not normal. Don't say that. Somebody said today that 30 BMI, I think Usha said that. So it's not 30, it's 25. You don't change the normal range of the BMI, okay? So 25, up to 25 is normal, okay? So please remember that whenever you are talking, you can, if you think that the station is extensive and you won't be able to deal with it, just say that we will talk about this. That means that you have said that this is important. I know the significance of this, and I am not letting my patient neglected. Okay. Did you get my point? So our purpose is we have to just make sure that we are not missing important things there. Okay. Okay, girls, I think we did a good amount of exercise today. I wish you all very good luck. Any questions and any ideas, keep dropping them in the group. Keep adding your serious friends to the group so that they can benefit, and we benefit as well when they are in the group, because we like to feel rewarded benefiting from what we are saying or what we are providing. Okay.
Thank you very much,
Any
Sam,
questions, girls, in the end?
for nice explanation.
Very well.
Yeah, Sam, one thing that, to review patient file, do you think that we need to ask permission to review her file?
No.
Yeah, so this is, for usually
this is a
here,
misconception. People keep thinking such.
Yeah.
If the patient was coming from another hospital, then you can ask her permission. If she's not being treated in your hospital, if she's referred from moved from another hospital to this hospital, somehow you need the notes from the previous hospitals, then you say that if you are okay with that, I'll write to your previous doctor to send us your notes. Would you be okay with that? Because if you are doing cross hospital, then you need a permission actually. But in the hospital, no. Please, no, absolutely not. People keep saying that, and thank you for highlighting, Salma. People keep saying that. That's very irritating. That I don't know who is teaching this foolish stuff to people. That you, with your permission, I will look into you. No, I will not seek your permission to look into your notes. Sorry, you come to me so that I can help you with your medical condition. I don't need permission for everything. So this is, I don't know who teaches that. Whoever is doing it is not doing a good service. Yeah.
Another thing for reservation, blood reservation, for all cases, we don't need to ask the reservation.
No,
do you have any reservation?
Only where you think that this patient may end up in theater soon. Okay.
Yes. Yeah. And now today, what we learned from you, that post-operative patient, so we'll ask only the recovery and that she has, how is her recovery, and also that any other things.
If the question was about diabetes, yes, because diabetes has, any immunosuppressive, and you can ask any medical conditions, because suppose if she has renal transplant, she's on immunosuppressants, that patient will also have, poor healing and all that. So it's a good idea to ask about the general medical conditions if she has diabetes or anything, but not like all the history, okay? Not like anything that could affect her healing. Yes, fine. Smoking, yes, you can ask, because smoking can delay the healing. She didn't ask me about smoking, okay?
Yeah, smoking. And I can go through her file also, because already operation done. We know all our history.
That's fine. Yeah.
Yeah. Then it will save my time also.
So, you can't, okay. That's funny thing. Whatever they have given, whatever they have given there, you only have that. You can't say, I'll go through your notes and you don't have her notes there. So whatever is not given, you will need to ask, okay? But you only need to ask the relevant thing. You actually made me say that as well. No, okay? So, but I'm saying this, stick with the important stuff that's relevant now, okay? So for instance, asking about incontinence symptoms, rather than asking what were your symptoms, tell me. I would not ask this question, what were your symptoms? I'll say, what's the improvement now? Like, are your symptoms improved afterwards? So then if she leads you to that, now I'm having one leak once a day. And now you don't know how many leaks you had before. So you can then ask that, okay, so it used to be more. She'd say, yeah, it was 10 times in a day. So that's a different thing, but they will not complicate you this much. Just, focus on the post-operative recovery and all the risk factors that could affect the healing process. And in that context, you asking about the general medical conditions. I still can't see how her children come there, like how many children do you have and all that. For me, that's very irrelevant, okay?
Yeah, this is what you told, it is relevant, that symptoms, it is improved or not. But the other history, like your period, cervical smear, and other things which are not relevant. So we don't need to.
No cervical smears. Yeah. Please don't ask cervical smears. No reservation to transfusion here. If you are prescribing, ask allergy. If you're not prescribing, you don't need to ask allergy. Okay. So you might be prescribing something. So when you are prescribing, you can, if you've forgotten to ask, you can ask right there that I prescribe you, whatever, if you're wanting to say, or if you're wanting to say that let's do a urine test on you. If there's an indication of infection, you might prescribe some antibiotics. Do you have any allergies? So say it in one sentence. I mean, this should flow like a stream in your mind. Okay, one more thing that I don't know whether you noticed or not, you guys still talk like you are reading. Why is natural flow not coming? Yeah, you need to talk fluently. You should not be sounding like you are reading something. And I feel that a lot when you are saying something, you are like reading. So when I share this video with you, please listen to yourself and listen. Why am I not sounding like I'm reading? And why do you sound like you're reading? Yeah. And you need to practice that. That's a very important thing for your exam. Okay. Got it, girls? Lovelies?
Yes, ma'am.
Yes, sweethearts.
We are afraid, that's why.
You don't have to be afraid, yeah? So important thing is do it on your own and then record it when you are alone and then see. Do you sound like reading then, or do you not sound like reading? If you still sound like reading, means you need to really focus on, because that that is a part of communication, okay? I mean, they do understand that you are overseas. It's not like they are totally, kind of very harsh about that. No, that's not the case. But that will give you an ease of expression. If you're trying to relax yourself, try to relax and try to talk. Don't try to read, try to talk. So they do understand that you are from overseas. They don't expect like, you talking like full flowing stream or something like that. Okay. But improving will help. All right. Okay, so lovely. Have a good day then, girls. Okay. Any questions, just drop them in Telegram and I'll try to respond.
When is your next session, Dr. Sam?
I'll try. I'll try. This has been after a long time, isn't it?
I like this brainstorming session rather than starting. Oh, I am so, and just to do like that. This is
just snippets.
Yeah, clips. Yeah.
Snippets, yeah.
Because
small
history everyone take, everyone say, but what is the role players question and how to answer them? That is the tricky things.
Yeah, absolutely. I'll be focusing on this because I came with this idea that rather than doing the full exercise of all the stages, I mean, this TVT was different because I wanted to see your medical, legal and all that. That's why we did that full. But otherwise, I only want you to focus on, you see, you don't see station as there will be just, a 10-minute exercise, you have to, this is a sprint, you have to just win it and all that. No. 10 minutes have got bubbles. Patient will ask you questions and they will fit in those bubbles. And you need to be ready with all those bubbles. So what I want you to do is, why don't you guys do one thing, please? All of you who are here, and then you can share it in the group. Take any, 4 stations, 3 stations, okay? And write the question, and underneath that, draw the bubbles, okay? And write your points and then share. So the bubbles should have the questions of what are the potential questions that somebody could ask you, the role player could ask you. And then underneath only points. Don't write stories. Salma, you have to focus on writing points because your stories are long, Salma. So they're scary long. I mean, I start sleeping when you sometimes your points are going so long. Don't do that in the bullet points. Otherwise, they will be illegible for me. Okay. So make bullet points like in the bubbles, 1, 2, 3, 4. Okay, just this much. I want you guys to start practicing this exercise. Write a station, question on the top, underneath draw bubbles. I want it in bubbles. I like bubbles and balloons, and you need to do that if you want my attention. Okay, if you want to write like lines, then I go blind. Okay, so make bubbles. Share with us, and we can probably add something to your bubbles. We can probably highlight something. So please try to do that. Okay. Okay. In your exam, templates, paragraphs, they're not going to help you. All right, girls.
And also that which one is, UK practice, which is we shouldn't tell, what we should tell, what, patient will mind that if we'll tell something unnecessary things. So this one also please correct us. Yeah.
As we
then
go,
it will be helpful.
Something comes. Yeah. As we go, if something comes, I always highlight anyway. It's just a matter of time. I have to be sincere with my students that those are my first priority. They are they have put their trust in me. So my time, most of my time goes there actually. Most of my time and my energies, they go there. But alhamdulillah, I try that whatever are the tips, I try to, whenever you're saying something, I try to give my insight on that so that it can help you. Okay.
Like today you discuss about the significantly high, we have to tell that BMI like that, so this is everything is important.
For a long time, Salma. I've been saying this for quite a few months now, that please don't say slightly high. Please don't say slightly high. That's mad. It's crazy that somebody has got a BMI of over 40 and somebody's saying your BMI is slightly high or is on the higher side. I mean, what are you doing there? That's very dangerous. You're giving her such a wrong message about this. She's comfortable. You have to go outside your comfort zone, and you have to bring her outside her comfort zone, and to deal with things that are important for her safety. Okay.
So if it is 30, how you'll explain that mildly? How you'll explain if
you can
is 30?
say that if I talk as per national guidance, your BMI falls in the mildly high category.
Okay.
You can say something like
that. Okay. Thank you.
Dr. Sam, one question. As I said, you can tell, okay, according to national guideline, then role player will instantly say what guideline you are talking about.
No, they won't say. They won't say. So the national UK guidelines. Just so you don't want to say national guidelines, say UK guideline as per UK standards, UK guidelines. Say like that, okay? Or it's even as per WHO guidelines. You know that if you ever try to read things, which I encourage you to do that, even WHO guidelines have got it like mild, more moderate, and then severe, and then morbid obesity. So it's even WHO, and who is the person on this earth who doesn't know WHO? Okay, so they won't.
Also, nice guideline, Sam. Nice guideline they mentioned. Also, my mother.
So all I'm saying is that you don't always need to remember which guideline. Just say UK guidelines. Fine. If they're asking further, and if you remember, say it. If you don't remember, say that I can check and share with you. That's not a problem. Do you want me to give you the guidelines? I'll give you a printed copy, and that's it. You don't need to. You can say I'll give you a printed copy of the guidelines. You're not going to give it to her, so they never know that you don't know which ones. Okay. They're not there to pin you down. They're not there to maliciously planning to fail you. They're not there for that. But you need to speak the correct words there. Okay? So don't worry that they'll pin you down that which guideline are you talking about, doctor? You're fooling me. Okay? Right?
Thank you.
Very welcome. Good luck, girls. Thank you for coming and bye for now.
Thank you, ma'am.
Thank you.
Very nice discussion. Thank you, Sam. Have a
Very
nice
welcome.
weekend.
You guys too. Oh yeah, my weekend half of it's gone. So you guys too. Bye. Bye. Take care. Bye-bye. Bye.